morning, I'm Jessica Lovell. It is Monday, May 13th. We had promised to bring you a story of a mom whose fight for her own daughter's food allergies turned into a $1 million idea. But due to an illness, that episode on food allergies will now be rescheduled. Instead, on this Monday, after Mother's Day, we are replaying one of our favorite episodes from earlier this year, featuring a mom who has more time with her husband now, thanks to the life-saving donation of her teenage son. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. LaCheryl Rainey calls her husband her Energizer Bunny. Ray Rainey was always busy, he was always active, until he wasn't. They didn't know at the time, but leukemia was zapping his energy. But today, Ray is doing well, thanks in large part to his teenage son, Micah. Today, we are learning how this family came together to help save Ray's life. When Ray Rainey learned that he had cancer, he also learned that it could be cured. That is thanks to the incredible work of doctors here at the University of Kansas Cancer Center, as well as Ray's youngest son. With me today is Ray Rainey alongside his wife, LaCheryl, and his 15-year-old son, Micah. Also, we have with us next to me is Ray's Dr. Mohammed Mushtaq, a hematologist and medical oncologist with the University of Kansas Cancer Center. Ray, I want to talk to you first because it's been 143 days since you got your bone marrow transplant, and we know Micah was your donor. I have to ask, how are you feeling today?
Today I'm feeling good. You know, sometimes, you know, it gets me a little bit, but most of the time I get up and I'm feeling good. Plus, my wife always say, Ray, get up.
She's like, get going. She's been, you don't have a choice.
Time to get up, yeah.
Time to get up and get going and get doing life. LaCheryl, I'm excited to talk to you today because I understand, well, first of all, it's your birthday. And you said when we talked earlier that this is just a great way to celebrate your birthday, getting your guys here and just talking about this really fantastic story. So take us back to a story that we were talking about what are the first signs that you knew that something was going on with Ray about a year ago?
Okay. So, like you said, today's my birthday. So it was actually about a year ago to the day. I was having a birthday party at my house with a few of my girlfriends, and one of them came to me and said, "Is Ray okay?" And I was just like, wow, because Ray had been saying he was tired, you know, but he was working a lot. He was working 7 days a week on his day job, and he had picked up a part-time job to help out our older son with school and things like that. And he was also doing some other side work, helping people build decks, doing floors. And so when he said he was tired, I just thought, of course you're tired.
Yeah, who wouldn't be?
You're doing a lot. You're doing too much, by the way. Well, and so when he said he was tired, we didn't think much of it.
You chalk it up to just living life.
Mm-hmm.
So, and I thought it was interesting because you're right, you live with Ray, but then it takes somebody from outside the home, a friend, to come in and go, wait, something's off, because I understand Ray was usually the life of the party, and he wasn't quite living up to that reputation that day. So, Ray, did you notice that you were more fatigued than usual? Did this type of fatigue feel different to you?
Yeah, it did. It did, because I was, you know, besides all the work I was doing, I just felt I was coming down with a cold or something, because I was really tired.
And you had no idea that this might be cancer until you decided to donate blood. So thank you for being a blood donor. We know supplies are usually low. What happened when you tried to donate blood?
Well, I guess I went over, I kind of ignored my wife because she didn't want me to do it because I haven't did it in a long time. So, but I ignored her, and I just happened to go over there, and they told, you know, after they ran tests and then they ran my blood work, they had said, well, you know, you're not gonna be able to donate today, but you need to make your doctor's appointment immediately because your blood levels are real low.
What went through your mind when you heard that? And what did you? I wouldn't have even known what that meant.
I didn't.
Yeah.
I mean, I was like, okay, you know, what does that mean? She just said, well, you need to go to your doctor and have him set you up an appointment to get your blood drawn and they can run tests on you. Well, I said, okay. So went to my car, called him. He told me to head over to LabCorp and
Like right away, go right away.
Yeah, he said the order be in, just go over there and get your blood drawn.
So you end up at another hospital originally where you were diagnosed, you were admitted?
Yes. After they ran, oh my goodness. It was a lot of tests.
And then they sent us to that other hospital, and we went through hematology there, and they ran a lot of tests, had a lot of questions.
Yeah, I bet.
And then he was admitted.
So how did you end up at the University of Kansas Cancer Center with this gentleman right here to my right?
Well, honestly speaking, I can remember some of it, but I was just too focused on if I was going to make it or not. You know, because a lot of my friends from school end up passing from cancer. So I was listening, but I wasn't listening.
Yeah, that makes sense.
She was listening.
She was listening.
My wife was listening, but
the doctor was like, you know, he told us, we think this is what it is. We can definitely treat you, but KU is where you want to be.
And what did they tell you it was?
They said they thought it was leukemia.
Leukemia.
Mm-hmm. They weren't sure at the time, but they were pretty sure that it was some type of blood cancer.
How scared were you?
I was terrified. I was completely
shocked.
Like it came from nowhere. And it was like in a matter of days we went from partying to Ray has cancer.
Wow.
Yeah.
So, Dr. Mushtaq, you know, talk to us a little bit about when somebody is sent over to you from another hospital. What are you looking at? How are you assessing a patient like Ray?
So we are privileged to have an excellent blood cancer and a bone marrow transplant program at University of Kansas. Excellent team of doctors, nurses, pharmacists, researchers. So in this situation, when somebody is suspected to have leukemia, we are the only leukemia center in the region, a member of National Comprehensive Cancer Network. So we try that patients are transferred to our program, and then they are started on treatment right away.
So is there something specific about Ray's diagnosis that made you very specialized in treating him? That's what I think I'm hearing you say.
So he had B acute lymphoblastic leukemia, so that's a type of an acute leukemia, and that can only be treated at tertiary care regional centers, especially the centers that have a bone marrow transplant and a cell therapy program.
So is it fair to say that this attempt for Ray to go donate blood on a random day is kind of what, you know, helped save his life and get him to you?
Yes, exactly. So in blood cancers, early diagnosis usually does not change outcomes, but if it is delayed, you can get into complications, organ dysfunction. So that was the right thing. Blood, everybody should donate blood, yes. At least a yearly basis. So he wanted to help somebody, and then he, in that process, found out that
helped himself. So either donate or attempt to donate blood. So let's talk about Ray's treatment plan. Was the bone marrow transplant, was that the #1 option? Was that plan A, or could there have been another treatment route?
So it depends. So in acute lymphoblastic leukemia, acute leukemia patients, not everybody needs a bone marrow transplant. Patients who have high risk disease need a bone marrow transplant. That's the only curative therapy. He had high risk disease, so that was the plan A from get-go. And he had high risk disease because with one cycle of chemotherapy, his cancer did not go into remission. So in those situations, our chemotherapy and immunotherapy medications, they are not enough to cure it.
You don't even bother going those routes. You go straight to the transplant.
No, they receive chemotherapy and immunotherapy drugs, and they get them remission. That usually means that we have cleared the field, but the seeds still remain.
Got it. And that's what happened with Ray?
Yes.
Okay.
And then a bone marrow transplant from a healthy young donor gives a new immune system, and that new immune system kills the cancer.
And we're going to talk about that very young donor here in just a moment. Ray's 143 days out. That's a crucial time period. What's next as far as getting checked up on, and what's that going to look like for him?
So the first year after transplant, unexpected things can happen, and He is now 143 days. 100 days we follow very closely, and now up to 6 months, 180 days, he'll see us on a weekly basis, and he's doing good at this point. There were some complications early on. They have resolved, and things are looking good.
So, LaCheryl, this became quite the family affair in more ways than one.
Yes.
You've got your baby sitting right next to you. Also, you have an older son, Brandon. He was in college at the time of all of this, this diagnosis. How did you walk your family through the decision to ultimately have Micah be your husband's donor?
Well, it wasn't easy.
Yes, I know.
We were hoping that someone else would be a match. And so, of course, people in the family volunteered to be tested.
Brothers, is that correct?
Brothers, sisters, and unfortunately, no one was a match. We were supposed to have Micah tested, but I was like, somebody's going to be a match, so we don't need to get Micah
And truth be told, I mean, donation is, by all accounts, is a safe process. But if you're a mom and this has just hit your family, you don't really know much about it.
Right.
And you're thinking, I don't want my baby to donate to anything or anyone, even though it's your husband. And so there's kind of this balance of trying to figure out, I want to save my husband, but this is my baby.
Right.
So
that's exactly where.
Yeah. So tell us about that a little bit, because that was a tough decision for you. You were hoping, you're like, nope, this person's going to make it. This person's going to make it. I don't even want him tested.
I just knew his younger brother was going to make it, and so I didn't even bother having, him do the test. So I started getting calls when the results started coming back one by one. Have you done the thing for Micah?
Nope.
No, not yet.
Nope.
So we need you to start thinking about that. Okay. So finally, I got the call. There's no match. We need you to
have him tested, because you don't even know if that was going to be a match. So what was that conversation like with Micah?
So that I think that conversation was kind of okay, because still we were like, well, we don't have to use you. We can use a non-family donor.
You just wanted to get him tested.
In my mind, yes. So we talked about it, and it was still okay. Well, we'll get him tested, and he came back, and he was a match. And so from the medical side, it was kind of like, yes, we've got this match. Let's go.
And from a mom's side,
I'm like, wait a minute, wait a minute. I didn't understand the procedure and the process. That is why I was scared. I thought it was a more invasive procedure. Micah's a straight A student. He's the lead snare marching band. He was starting in football, JV, playing varsity football, jazz band. I didn't want to, disrupt his life. I didn't know, in my mind, he's going to be in the hospital for several months, and we've got other options for Ray. That was what my thinking was at the time.
Yeah, that's where your head was.
Yes.
Micah, where was your head when this was all presented to you? What were you thinking?
I was a bit nervous, I'm gonna be honest, but I knew if it was gonna help my dad live, it would have to be me.
What questions did you have? Do you remember just when Mom talked to you about it, you get tested, you find out you can come in and kind of save the day for Dad? That's a big responsibility, but you must have had questions.
I was just more worried about being under anesthesia, because I had never done it before, and I was really excited to have it just done, just have him cured, to be honest. And I was worried about how long I would be out from all of my activities like football, band, and stuff like that.
Yeah, you just wanted this behind you. You wanted Dad healthy and get back to living your life, right, in high school. So transplants like these have two possible methods: stem cell collection, which is kind of like giving blood, and then there's bone marrow transplants, which we're going to show you in this video right here. The donor needs to go under anesthesia, as Micah said, then have bone marrow collected from their lower back, and Micah went through this kind of what's called a bone marrow harvest. So Dr. Bushtag, why did Micah do the harvest instead of the stem cell collection? Why was that the route?
So there are several nuances in how we choose bone marrow versus the peripheral blood stem cells, but simply bone marrow is rich in stem cells and less immune cells. So that means less anti-cancer effect, but also less risk of complications such as graft versus host disease. So that is preferred source in somebody who's young, like Ray, where there are like several decades of life ahead, and we don't want rejection complications. Peripheral blood stem cells, on the other hand, are rich in immune cells, so there's quicker recovery of blood cells and more anti-cancer activity. That is usually preferred in patients whose cancer is not in good remission, older patients where bone marrow soil is not good.
So Micah, what was the harvesting experience like for you? Was there, any pain or soreness, recovery?
It wasn't even that long of any soreness. Honestly, it was a couple of days after the procedure where I felt like a little tightness in my back. I couldn't move the way I used to and stuff like that. And I was just fatigued. I was very tired, and that's about it. It was very short length.
Short, in and out. So, LaCheryl, you snapped a photo of the moment when Micah was at Ray's bedside and you got to watch those cells go into his IV. Was that kind of a special moment?
Yes, I can't even describe the way it felt. Both procedures were on the same day, so we were at Children's with Micah, and then the bag was delivered to KU, and then I had to deliver Micah to KU so we could be there with Ray. And so the feeling of sitting there watching is just indescribable. I just don't even know how to describe it.
Well, Micah, we talked about football and marching band, very involved in your high school. I think you did have to miss the homecoming game, but just again, tell us a little bit more about what it's like to be back. I know you've had a huge support with your school. And where do you go, by the way?
I go to Grandview High School.
Great.
Yeah.
Were the kids supportive? I bet they had a lot of questions too, right?
After the procedure, I had messaged some of my friends on the football team, told them I was fine and stuff like that, and I'll be back soon.
You'll be back?
Yeah.
I bet they thought that was pretty cool.
Yeah, and my head coach and my other coaches were very supportive throughout the journey. They were telling me how proud they were of me and stuff like that.
Oh, I bet they were. Yeah. I bet they were. A very proud moment for them. So, Ray, let's talk about the gong show here a little bit. There's a photo of you banging the gong there at the BMT unit. Yeah. We know, though.
I think that was, twice?
Yeah, I got to do it twice.
Because I kept going back to the hospital.
So, good. I like it. Bang it. Okay, so, but we know that it's past this. You got the recovery time. We talk about that in crucial 100 days. But how long till you really started feeling better?
I guess the first, it was I started feeling better after the first 100 days. I started getting a little more stronger in eating because I couldn't, I couldn't eat. I couldn't keep nothing down. It was pretty hard because I wanted to eat, but I couldn't taste anything. So, but after a while, 3 or 4 weeks, I was able to eat, but it had to be spicy. I couldn't eat anything just regular because I was always constantly chewing it but not swallowing it. So I think my wife had made me some chicken wings, and I put hot sauce on it, and I was able to eat it.
You had to kick it up a notch.
Yeah, but I was able to swallow it with no problem.
Chicken wings, that's a good recovery food, right? I'm totally on board with this, by the way.
But yeah, I was, like I said, I couldn't keep nothing down.
Yeah.
And I was just constantly chewing it and chewing it and chewing it. It's like, man, I'm getting tired.
Yeah.
So I had to get a napkin, spit it out.
Well, it's
My wife,
those
she
little
said,
things.
"You eat?" I said, yeah, I ate.
I bet she was all over it, but it is those little things you take for granted.
Yeah.
Eating, chewing, swallowing, tasting food. I know, LaCheryl, throughout this whole process, you've had so much support. Micah was talking about coaches and friends at school. Who's helped you the most, you and your family the most?
For me personally, I would really say my older son, Brandon. Because Ray is the rock. He's the rock of our family. And so when Ray was sick, I was lost, but we had to tell the boys, and it was Brandon and Micah who reminded me that we trust God. You know, we have faith, so we are not going to be scared. We're going to trust God, and Daddy's going to be okay. So they helped me a lot. I had to do so much more than I was used to doing, because Ray used to do everything for us, and so Brandon actually came back home. And he started, you know, he was doing a lot of the shopping and things like that to help. And then Ray's brother Joe kicked in, and he helped us a lot with doctor's appointments, visiting at the hospital, you know, bringing. Ray changed sizes probably 4 times. So Joe did a lot of shopping for Ray. So I would say Brandon, Micah, and Joe were the biggest help.
It is not one person. It falls on the shoulders of many and many around you. Hang tight for just a moment. Be sure to ask your questions. You can use the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. That info is right there on your screen. Before we get to Dr. Hawkinson, I do want to ask Dr. Mushtag about the news that just came out from the FDA. They approved a brand new cancer treatment. It's called TIL, spelled T-I-L. It uses your own immune cells to attack tumors. And Dr. Mushtag, you have been researching TIL therapy. So while we have you sitting right here, tell us a little bit more about what it is and what this means for patients.
So this is a remarkable breakthrough for the patients. There are young patients with melanoma, and that has spread or it's not responding to immunotherapy. And for these patients, the life expectancy is measured in few weeks. And this therapy, we resect the tumor, we take the tumor out, and there are immune cells that are in the tumor. And those immune cells, we think, know how the cancer looks like. So we expand and enrich them in the lab and then infuse them back to the patient to fight the cancer. And we have seen 30 to 40% of those patients responding to this therapy. And really encouraging is about 10% of patients with a long-term 5-year follow-up have not had melanoma come back, and that's exciting.
Very exciting.
And this is just the first generation of these therapies, and these will get better in future years with cell engineering. And
we are going to have an entire show talking about TIL therapy. So we're going to have you come back on. Sound good? Thank you so much for that. A couple quick questions from our viewers. Yen Liang wants to know, which one is better, CAR T therapy or blood cell transplant in a case like this one, or maybe others similar to it?
So it is very different therapies, and it's a lengthy answer. But if somebody's cancer is not going into remission, then CAR T cells are used, and these cells fight the cancer and induce remission. Once somebody is in remission, to maintain the remission, a bone marrow transplant is used that replaces their immune system with a new one and reduces the chances of cancer coming back.
So on that note, do donors need to be the same race as a recipient, and is there any such thing as just the ideal donor?
No, a donor doesn't have to be the same race. They have to match genetically. Yes, there are several factors that we consider, but an ideal donor is a young man and ideally a fully matched sibling. And if you don't have that, then a fully matched unrelated donor. And now with advances in the medicines used to prevent rejections, graft versus host disease, we can use partial matches such as Micah with exactly the same outcomes that we have with fully matched donors.
So I want to get our takeaways today. Dr. Mushtag, let's stick with you. What do you want people to know?
So 2 things. So one is that the bone marrow transplant cures blood cancer and blood disorders. These are very curable diseases. We are lucky to have University of Kansas blood and marrow transplant program. We do over 300 transplants a year. The program is ranked among top 15 with a 1-year survival of almost 80%, and that's only possible with the support, this extended social support networks and our team that we have. But one missing piece of the puzzle is the donor. So if you are an African American, your chances of finding a donor are in the registry, unrelated donor, at 29% compared to 79% if you're a Caucasian. So my message is that go to National Marrow Donor Program Be the Match website.
It's very easy, right? You just swab and send it back in?
Sign up as a donor and they'll send you a kit at your address. You swab and send it back and you will be on the registry.
And then you wait for a phone call.
Yes.
Yeah,
yes.
Never know when it might come, and you can save a life. Ray, what's the takeaway from your story?
takeaway from my story is, you know, I have to, I mean, if it wasn't for, you know, my faith and my family, oh man, it was, you know, that was the main thing that, you know, helped me to pull me through.
Yeah.
Because, you know, when I first found out that I had it, it was all kind of negative things going through my head, you know, and I was trying to make sure everything is in place, you know, far as, you know, if I had the wheel and all this. I mean, it was just all over the place. But, you know, like I say, through my faith and my family, you know, it ended up being good.
Sure did.
Yeah.
Another takeaway, always listen to your wife.
Oh, yeah.
Yes, ma'am. Okay, Micah, just what's the takeaway from this story?
My takeaway is that things like this, they take time and patience, and if it's worth saving a life, you can do it.
You did good.
Yes.
You did good, my friend. All right, Mama. So, LaCheryl, I'm going to let you wrap us up today. What's the big takeaway from your family story?
For me, it's information. Learn about donation and the process. I didn't want my baby to do it because I didn't understand. But once I learned about the process, I mean, I knew that I knew we were going to do it. But knowing the process, knowing more about it, made the decision easier. So information, learn about it, and donate.
Donate. Dr. Mushtek, thank you for being here, and thank you, Rainey's, for sharing your story with us. Really important.
Thank you for having us.
Thank you.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.